February is American Heart Month, and Intermountain Health, the sponsors of this segment, want to remind you to prioritize your heart health. We spoke with a doctor at their Green Valley Cardiology Clinic to learn more.
Unfortunately, we have been in an epidemic of obesity, diabetes, both of which are significant cardiovascular risk factors. A lot of people don't think they're the ones that will end up with heart disease, and this may be more notable in females who often are taking care of everybody else in their family, including their husbands, and they don't realize that they are just as much at risk for a heart attack as men do, albeit it may be a little bit later in life, but still something that they really do need to be aware of. One person every 36 seconds dies from a heart attack. So we all need to get to know our numbers for prevention. So the first number I would recommend knowing is your blood pressure. 140/90 is the upper cutoff limit, but we're really shooting for a number closer to 120/80 as far as being a normal blood pressure. Body mass index is important. When your body mass index is greater than 30, you certainly are at risk for heart disease. You're usually also at risk for the development of diabetes. People who have elevated blood sugars are certainly at risk for diabetes, and one of the best ways we know how outside of dietary modification is to start and begin a regular exercise program. So the American Heart Association recommends 150 minutes of exercise. You can break that up any way you like to, 30 minutes, 5 days a week. We also know our patients who have what we call high waist to hip ratios, meaning you carry most of your adipose in your abdominal region, you're at higher risk for heart disease. Another set of numbers that we would like our patients to be aware of is their cholesterol numbers. A person's total cholesterol is the amount of total cholesterol in the body that is floating around in the bloodstream. And it is composed of different parts, including HDL cholesterol, which is thought to be protective, and LDL cholesterol, which is thought to promote the formation of plaques in the vessels. We do a simple blood test to measure the total cholesterol as well as the breakdown of that, the HDL and the LDL. I'd like to provide some tips for remaining heart healthy. Try and eat healthfully, including lots and lots of fruits and vegetables, more fish and chicken than beef or pork. Try and eat foods that have fiber in them, and use a lot of olive oil. And another big one that has come to light more recently is getting enough sleep every night. That's very important.
Thank you, Intermountain Health, for sponsoring this segment. Head to intermountainNV.org/cardiology for more information.